So first of all, I would like to thank all the conference committee members for having me on this International Conference on Computing and Innovation, ICCI 25. And the title of my talk is about computational intelligence in healthcare, navigating hope and hype, particularly in Pakistan. About me, there is just a bit correction that I'm working as an associate professor at the Department of Computer Science, Beijing University of Technology, China. I'm among the top 2% scientists as per the Stanford University list. I'm the senior member of IEEE and also the fellow member of Pakistan Academy of Sciences. I'm also the recipient of the Young Scholar Forum Award from the Marconi Society, along with Outstanding Graduate Award from the Ministry of Education, China. Beyond this, I'm also listed as the 100 top scientists in AI as per the AD Scientific 2025. Here is my brief research profile with respect to Google Scholar. So in today's talk, I'm discussing about the healthcare challenges and how we can mitigate all those challenges along with the different policymakers. So starting with the healthcare crisis, as we can see that most of the Pakistani people are living in the remote areas, and that actually provides some unprecedented challenges to overcome those kind of the innovative solution with the help of AI and some other solution. So with the rapidly growing population and limited resources, the gap between healthcare needs and available services, there is need to continue the widen. So Pakistan healthcare reality, the stats indicates that in the city areas, the ratio with respect to the doctors is doctor to patient ratio is 1:1,000, and this ratio may be 1:3,000 to 4,000 in the rural areas. There are more than 40% people are living in the rural healthcare access, where 1.4 million projected workforce gap that may be envisioned up to the vision of Pakistan government 2030. The growing burden, particularly with respect to geographic disparities, most of the people are living in the remote areas of Punjab, Sindh, and KPK. So these rural population faces several healthcare challenges with limited travel distances and inadequate specialist availability that may create some barriers for timely medical intervention. Urban overloaded, although there is the ratio, the doctors are seeing, current stats indicate that the doctors are actually seeing the patient for 40 patients a day, but this may the figure increase in some other cities. So urban healthcare facilities struggle with overwhelming patient volumes, creating the long wait times, strained resources, and obviously compromised quality of care for millions seeking the treatment. So what is actually computational intelligence? Computational intelligence is something we can actually use some different machine learning, deep learning, NLP, and computer vision based algorithms that may assist the doctors in such a way that they can actually reduce the burden of the doctors and the healthcare professionals. They may even help to maintain the history of the patients. They may help to provide some telemedicine for the people who are living in the rural areas, so they don't need to cover a long distance to visit a doctor. They may simply talk the doctor with the help of any kind of the expert system or telemedicine system, where they can simply give their vitals or simple kind of the symptoms, and they may actually be seen in the kind of initial treatments. So what is the promise for the real application? With the help of computational intelligence, this might be already transforming the healthcare delivery in Pakistan and worldwide, with tangible benefits for the patients and providers alike. As we mentioned earlier, that uh, people who are sitting in the remote area of Sindh, he don't need to visit some mega cities like Karachi and Lahore. He or she can simply give the symptoms, and then these kind of the computational intelligence based AI system can give them the initial kind of the diagnosis with respect to any kind of the disease, and then they can suggest that whether they have to visit for a larger stages or the next stages of the diseases. AI powered diagnostic, there is the example of 𝗖liche, revolutionary medical imaging techniques like X-rays, CT scan, MRIs. So this 𝗖liche actually provides some leverages for the advanced computer vision algorithms to provide fast, accurate medical imaging diagnostic, assisting caregivers in making critical decision. So in a simple way, this is something like in Pakistan, still one part of the medical imaging has been advanced a lot. If we talk about the X-rays or CT scan, still if you just visit in your surrounding, you can see that many doctors, they have to just simply put those kind of the X-rays in the front of light, and then they diagnose it manually whether a person having any kind of the knee injury or something like that. Even ultrasonic images has been advanced a lot, but still what the doctor have been doing, they just put the light on it and then they manually interpret the pattern behind that, and then they suggest that whether there are some kind of abnormalities or not. So if we talk about one aspect of the infrastructure that has been improved a lot, but another aspect that AI-based algorithms are not being properly equipped, or we are not actually been using, or we are lacking some kind, if they are exist, but the accuracy is not strong enough. So we have to look for those kind of the algorithm where we simply input any kind of the X-ray image, and then we can simply we can have the solution for that, or we can simply diagnosis for those kind of the X-rays or other kind of the imaging modalities. Telemedicine transformation, this might give some remote consultation. The people who are living in the remote areas, everyone nowadays have the access of the smartphone and even the internet facilities, so they don't have to visit physically for the doctors. Rather, they can help through with the help of the telemedicine. They can simply provide some symptoms, and they've been suggested with any kind of the solutions. Digital health records, with the help of telemedicine, you can simply keep track of all those patient histories. Patient histories are maintained rather than simply seeing a doctor for the first time. If the history has been maintained, and we see that history is one of the key concern in the medical domain. Also, AI assisted triage may provide some prioritized patient. If the patient has been in the serious conditions, they may be like uh, given the higher priority to check that and to provide some solution behind that. This might reduce the wait time for the patients. Predictive analytics, personalized medicine. This may come with the different steps, starting with the data collection, and obviously a lot of hospitals in Pakistan, they are actually been providing the data, but the data is not in proper order. Firstly, we have to maintain the data so that we can easily keep track the history, and we can easily keep track the diagnostic process. Based on the data collection, what we can do that we can perform any kind of the AI analysis, like we can do machine learning, deep learning, to identify the hidden patterns and predict the disease risk. Personalized treatment, we can give the personalized treatment that might be tailored as per the intervention based on the individual patient profiles. This might improve the outcome with respect to 20 to 30% better health result through this precision medicine with the help of AI-based solutions. The impact by the number, as I mentioned earlier, the personalized medicine can improve the healthcare outcomes from 20 to 30%. AI market growth, as per this CAGR survey report, Pakistan AI market expansion projected by 2025 is 30%, and it might reach up to 50% by the vision of 2030. It might reduce the diagnostic time up to 50%. So maybe half of the burden on the doctor, as we mentioned earlier, the patient and the doctor ratio is 1:1,000. It might be reduced up to 500, 1:500. This is again still a huge number as per the WHO stats. The ratio should be 1:14, but it's not been possible. Uh, Even some kind of the innovative solutions, the reality check, the challenges ahead, and despite the enormous potential implementing computational intelligence, Pakistan healthcare sector still faces the significant obstacle that might be addressed for successful adoption. Critical barriers to adopt, there is a talent shortage. Only 1,000 to 1,500 AI experts are currently in Pakistan. So obviously, with the passage of time, AI being evolving in every aspect. With respect to particularly AI, there is a need to train the doctors, all those healthcare professionals who are being actually using the AI actually, or implying the AI. They need to train how to actually use those AI-based solutions. There is a regulatory gap, although on the global perspective, federal drug authorities, FDA is already doing a lot of regulation. Like there are three classes has been already introduced from class 1 to class 3. The class 3 is something where all those like recently pneumonia chest X-ray based devices has been launched. So this is fall under the class 3. So this, but in particular in Pakistan, there's the lack of comprehensive frameworks that might govern AI in healthcare, creating uncertainty around liabilities and the standards. Infrastructure limitation, as we mentioned that imaging techniques has been advanced, but still there are a lot of infrastructure limitation. There is inadequate digital infrastructure, particularly in rural areas, that might hamper the deployment of AI-based power healthcare solution, as we need that AI-based solution needs a lot of resources. So obviously it may produce some hampers or some challenges, particularly in the remote areas. Funding constraints, limited investment in the healthcare technology, although the world largest companies like Google and IBM, they are already doing some wonders in the healthcare perspective. But if we talk about the Pakistan, there are still a lot of challenges in terms of the funding, acquiring, and scaling for the successful pilots. So there is the trust gap, building confidence in AI. As per this 𝗛𝗲𝗃𝗃𝗃, confident AI is something that the essential skills for working with AI. So healthcare provider and patients alike express concerns about AI reliability, data privacy, and the potential loss of the human touch in medical care. So there is some skepticism about the AI diagnostic accuracy, although the results are still promising. We are getting the accuracy up to 80s and 90s. That may be considered as a good, but there might be some challenges as the data is not data may prone to error, or data is not generalizable. So there is also fear of about the job displacement. If we work on the AI could be there to replace the human, but actually AI is to assist the human, not to replace the human. There are some privacy challenges, obviously, with respect to data, but still the solution are there that worldwide HIPAA, this is basically a Patient Privacy Act, has been already launched by the federal government, Federal Drug Authority in United States. And obviously there are some cultural resistance to technology-driven care. Maybe one thing that is best fit in the US, but that might not be best fit in Pakistan as per the cultural challenges. So looking for the charting the path forward, strategic inventions across education, infrastructure, regulation, and investment can unlock computational intelligence transformative potential in Pakistan healthcare sector. So obviously we need to take all those policy makers in one umbrella, that everyone should be trained as per the AI based education. There should be need to bring all those infrastructure. There is a need to take on board for the regulatory bodies, and there is a need some kind of funding companies that may give some investment for all those healthcare startups. So in all these combination, we can be looking for some path forward. Strategic interventions, invest in AI education, expand the digital infrastructure, create the regulatory framework, and foster the public-private partnership. Maybe we should look for some tech companies or some academic institutions to accelerate the innovation and adaptation. Pakistan unique advantages. Pakistan is been actually been blessed with young and tech savvy population. Most of the Pakistan population, around 64% of Pakistan population, is under 13. With increasing digital literacy and enthusiasm for technology-driven solutions that may create a fertile ground for AI adaptation. There is a growing IT sector. Pakistan IT export exceeded 2.6 billion in 2023, maybe 3.5 billion in 2025. So with a thriving startup ecosystem that actually demonstrate a strong technical capabilities and entrepreneurial spirit, global diaspora network, million of Pakistani professionals are working in a leading tech companies worldwide that may offer the technological transformer investment opportunities and international collaboration potential. So these key constraints actually provide us the motivation that why actually we should look for some AI-based startups, and why there is the need that we actually should come with the solution of any kind of the problem with respect to the healthcare perspective by using or implying AI-based solutions. There are some success stories with respect to global inspiration. India's 𝗖ecie𝗺𝗁𝗃𝗁, this actually telemedicine platform, this might serving the million of people in the rural areas, and they are there to actually gather the data. They provide some basic symptoms and diagnosis of the diseases. Similarly, Africa's 𝗪 revolution has been already launched. This was actually mobile first healthcare platform that was launched by the South Africa government that provide vital services through basic phones and SMS technologies. China's AI hospitals are already there. We are witnessing all those China's AI hospitals that provide advanced AI integration in urban hospital, showing dramatic improvement in diagnostic accuracy and operational efficiency. And the picture here is being generated from AI, but this kind of the picture has been from the real aspect as well, that recently China has been doing some surgeries based on AI-based robotics. So where we actually stand that there is a hope that AI is there to help the human, they are there to improve the diagnostic performance, but there is still a lot of hype. Um, the hype is something that AI is something, if we been not equipped properly, AI is going to replace the human and something like that. But we should look for a balanced view. The realistic hope is that AI can significantly improve the diagnostic accuracy, expand access through telemedicine, optimize resource allocation, and personalized treatment plan based on the robust evidence. Uh, the hype, as I mentioned earlier, that AI is to replace the human, but we have to actually avoid the hype. AI wouldn't replace the doctor entirely, although they are going to help the human. They are help to or even assist the doctors. So there is the need to solve all healthcare challenges overnight, work without quality data and infrastructure, or eliminate the need for human judgment and empathy. These are kind of the hypes, but this doesn't reflect on the realities. The ethical imperative, patient privacy is a key concern. Uh, whenever we talk about the computational intelligence in healthcare, there is the need that we actually look for some global acts like HIPAA is there to actually protect the privacy of the patient. Uh, Based on that patient privacy protected data, we can use it for any kind of the research purpose or for any kind of some kind of the development purpose. um, we are looking for some algorithm bias. Maybe we have been looking for some generalized algorithm that might be best fit for all kind of the disease diagnostic rather than looking for a single part or single kind of the diseases. So this is again kind of the challenging thing, but because most of the algorithms are providing some bias, maybe one algorithm is based on some specific data, and we may not put simply for a generalized data. There is the need of accountability to define responsibility when AI system make error. So AI responsibility, this is a separate field, and definitely it is something, whatever been provided by the AI, it should be clearly depicted or reflected through the help of explainable AI, which particularly factors or feature been producing, or what kind of the percentage of those features in particularly decision making. And equity is about ensuring AI benefits that might reach the underserved populations. Call to action, who must act? Obviously, first thing is about the government bodies, policy frameworks, infrastructure investment, research fundings, or regulatory clarity to enable AI healthcare innovations. Academia, AI focused curriculum development. So we have the AI degrees like the bachelor's in AI and a master's of AI. There is need for the research partnership with some kind of all those the companies who are working in particularly AI in healthcare field, and there is the need of the talent pipeline creations to build the expertise. Healthcare provider, there is also the call to action for the healthcare providers for the early adaptation. They should look for some pilot program. There is the need of data sharing among all the hospitals and all those research institutions. In Pakistan, there is a lot of challenges with respect to data sharing as well. So there is the need to actually give the policies with respect to data sharing and continuous learning to integrate AI into practice. If we talk about the tech sectors or AI-based companies, there is the need of healthcare-focused AI solutions that might look for some local partnership or even some global partnerships and affordable technology to serve Pakistan unique needs. Key takeaways for today's talk is about the computational intelligence offers transformative potentials for Pakistan healthcare system. It gives some significant challenges that there is a need to be addressed systematically, particularly the shortage of the talents. There is the need of AI-based training, infrastructure gaps are there. The third key takeaway is about Pakistan possesses unique advantages for AI adaptation. Most of the Pakistani population are under the age of 30. Pakistani IT sector has been already evolving worldwide, and there is the global diaspora network position where Pakistani people are currently heading some renowned companies worldwide. So all those being grouping and the collaboration can help to start the initiatives in Pakistan. There is also need of success that requires separating hope from hype. So there is a lot of hype has been there. We actually look for some realistic expectation. We don't just consider that AI is there to basically replace the doctors, or AI is there to solve any kind of the problem overnight. Everything takes time, and it might be under some stages. So road ahead from 2025 to 2030, some recent 2025 to 26, there is basically need to establish some regulatory frameworks that may launch AI education programs, pilot telemedicine in rural areas from 27 to 28. There is this need to scale some successful pilots projects that has been launched. There is the need to expand the infrastructure, build AI healthcare workforce. Currently, we have around 100 to 1500, 1000 to 1500 professionals, but we may look for more than 5000 professional, or even this number may be greater in the coming years. From 28 to 2030, there is a need of nationwide AI healthcare integration by addressing 1.4 million workforce gap that might exist right now, but 2030 this gap may be much be bigger than that. So we just need to achieve some measurable outcome improvements. Join the conversation, shaping the future of healthcare in Pakistan. The journey from hope to reality requires collective action, informed dialogue, and sustained commitment from all those stakeholders, government, academia, and all those companies. So let's separate fact from the fiction and chart course for the computational intelligence-driven healthcare innovation that serves all Pakistan. So that's all from my presentation. If you have any question, you may ask, please.